Almost everyone will be in a hospital for an extended stay at least once in their lives, some more. And unless you're not eating or restricted from eating, you'll come into contact with the hospital's room service. While not all hospitals have the same procedure for the actual delivery of trays, the procedure for entering and delivering a tray to a patient's room is the same in every hospital. I work at Methodist Jenny and Winston Hospital, where, not to be biased, everyone is extremely nice and willing to go above and beyond for the care and service of the patient. Hospitals are places where people go when they are in pain and need to be cared for. So it's important that the people that a patient comes in contact with are extremely caring and observant of a patient's needs. In order for a room service ambassador to do this, they must complete the procedure for delivering trays to rooms. The first step in delivering a tray to a room starts before even entering the patient's room. You must first sanitize your hands in order to not spread germs from each patient's room to the next. You must check your trays for accuracy and make sure there's nothing missing on the trays. Then you must pay attention to any signs on the doors, because there are contact rooms which you are not permitted to enter. Only the nurses can, so you must leave it on the nurse's desk. Or there are signs that say to check in with the nurse before entering the room. After you've checked for these signs and determined that it's okay to enter, you must knock and identify yourself as room service, and then wait for permission to enter the room from the patient. Okay. The next step is upon entering the room. You must greet the patient by the name that's on the ticket that's on the tray. After you've greeted the patient, you must ask where they want the tray on the room. Some want it on the bed, just beside them, or some want it in their lap if they're sitting up. But the majority of the time, they want it on the sliding tray that's in their room, and you slide it over the bed or on the side, whichever they prefer. Next, you ask the patient if they need help opening anything. Some patients don't have the best use of their hands because they're elderly or they've had surgery. So they need help opening things or lifting things or even cutting things. Next, you ask the patient if they need anything else. Even though you checked, you might have missed something, and they might need like a milk or a juice or something small that's missing from the tray. And then after that, you check the wristband, because it's very vital that the person that's getting the food is the person that's in this room. Because if not, they might be on the wrong diet, like a liquid diet, and they're getting solid foods. That would be very unhealthy for a patient to get that. Next, at the bottom of the ticket, it's either blank or there's a notified nurse symbol. The notified nurse symbol means to notify the nurse because the patient is either diabetic or needs help eating their food. Okay. To recap, we talked about the benefits of delivering the important caring service of hospital employees, and then we talked about how to enter a room when delivering a tray, and then how to deliver a tray, how to set up a tray in the patient's room. Thank you.